Have you ever wondered if red light therapy, a trending wellness treatment, is truly effective or just a passing fad? Today, we'll explore what science actually says about red light therapy, also known as photobiomodulation or low-level light therapy. This treatment uses low-level wavelengths of red and near-infrared light, reportedly improving skin appearance, reducing pain, and promoting healing. It involves exposing the skin to a lamp, device, or laser that emits red light, which penetrates shallow depths without generating heat. This exposure may produce a positive biochemical effect in cells, strengthening mitochondria and increasing ADP production. Red light therapy is thought to work by acting on the mitochondria, often called the power plant of the body cells. When cells absorb specific light wavelengths, particularly in the red and near-infrared spectrum, photons trigger photochemical reactions. This process leads to an increase in ADP production, allowing cells to work more efficiently, repairing skin and boosting new cell growth. Studies suggest promising results for skin health, including reducing wrinkles, fine lines, age spots, and acne by stimulating collagen production. RLT can also be an effective treatment for androgenic alopecia, a genetic disorder causing hair loss, promoting new hair growth. It may promote wound healing and tissue repair, accelerating the body's natural recovery processes. Red light therapy may also be useful for relieving certain types of pain, particularly those associated with inflammation. It could be a helpful short-term treatment for pain and morning stiffness in patients with rheumatoid arthritis. Other potential benefits include reducing cancer treatment side effects, treating carpal tunnel syndrome, and improving neural function. Despite these promising findings, the effectiveness of red light therapy is still debated among experts. Some experts emphasize that more clinical research is needed to confirm its full efficacy across all claimed uses. While generally safe when used correctly, especially in the short term, there are potential risks and side effects to consider. Red light can damage the eyes, making protective goggles essential during treatment. High levels of red LED lights or prolonged exposure outside guidelines can cause skin damage like blistering and redness. Individuals taking photosensitizing medication or with medical conditions causing photosensitivity should avoid RLT. People with darker skin tones may experience hyperpigmentation due to increased sensitivity to visible light. Many types of red light therapy devices are available, including masks and beds, some for home use. However, home devices are typically less powerful than clinical ones, potentially requiring longer treatment times for similar effects. When considering a device, look for FDA clearance, which indicates it poses a low risk to the public. Remember, FDA clearance signifies safety, not necessarily effectiveness, so research is still key. If you're interested in red light therapy, always consult your healthcare provider to determine if it's a suitable option for your specific condition. In summary, red light therapy shows promise for various wellness applications, from skin rejuvenation to pain relief. Its mechanism of action on cellular mitochondria is scientifically intriguing, offering a glimpse into its potential benefits. However, the scientific community continues to call for more rigorous clinical trials to fully validate its widespread claims. Always prioritize safety by using FDA-cleared devices, wearing eye protection, and consulting medical professionals. Red light therapy is an evolving field, and staying informed with balanced, scientific information is crucial for making personal wellness choices.